When we did a series on stroke, we defined stroke. We were able to talk about the types of stroke, ischemic and hemorrhagic stroke. We also mentioned transient ischemic attack, TIA. We talked about the signs and symptoms, pathophysiology, epidemiology of stroke, and so on and so forth. So today, we are going to be talking briefly on stroke management. I live in River State and Port Harcourt to be precise. So in this part of the globe, there is so much belief in tradomedical, things. People believe in native masseurs, native massagers. They believe that stroke is basically a spiritual problem that has no medical inclination. They believe that stroke is not well managed in the hospital. It has to be a traditional thing. If you have been indulging in these practices or you have been deceived before now, pay very good attention. Listen to me. Watch this video attentively. Stroke is a medical condition that is managed in the hospital by health professionals. There are two principal ways of stroke management. One is medical management, number two is rehabilitation. And these two form of management are not really distinct from each other. It's not as if they are too distant from each other. They can run concurrently, they can run pari passu. If the patient is managed in the hospital setting or in the clinic setting, these two treatments can go on side by side because those who administer this treatment are professionals in their different fields. Medical management is so important for the stability of the patient. Take for instance, if the stroke is caused by high blood pressure, the patient high blood pressure has to be stabilized by the use of antihypertensives and some other medications that will ensure that the patient is stabilized, and these are prescribed by professional qualified medical practitioners. These things, you don't get them by the roadside, you don't get them in the interior places, you get them from right medical practitioners, qualified medical doctors. They will give you medical assessment and give you medications for the stability of the vital signs of that patient. Then rehabilitation is given by rehabilitation expert. We have the physiotherapist, we have the occupational therapist, speech therapist, and so on and so forth. The physiotherapist is the leader of the rehabilitation team. So he is the one that principally assesses the patient's function, assesses the patient's muscle strength, and ensure that the muscle strength of the patient is improved, and ensures that the patient becomes functionally active, and also the patient can go back to his or her former profession. That is societal integration. Pay very good attention to understand this. This thing I'm telling you, you cannot get these things from the masseurs. You can't get these things from the interior places that you take your patient to. So if you get a patient to the hospital, it is a multidisciplinary approach whereby all the health professionals, they gather together, and each health professional will play his or her role to ensure that the stroke patient recovers fully. So when the patient is seen medically and the patient is receiving medication, the patient is being treated by the rehabilitation expert, the rehabilitation team, at the end of the day, everybody plays it. Even the dietitian, the dietetics, those in the dietetic department, they play role. Even the clinical psychologist, the counseling department, and everyone plays their role. You cannot get these things when you take your patient to a particular local place for management. Listen to me attentively. This is 21st century. We are no longer living in the Stone Age. We are living in an era where people are educated. Do the right thing. Come on time to the hospital. Present yourself on time to the right health professionals, and you will be counseled aright. You'll be treated aright to avoid complications. In my hospital at the University of Port Harcourt Teaching Hospital, we normally discover that in our clinic, you see that by the time most patients come, they must have gone to those local places, and it is when the patient has come down to complications that you see them running back to the hospital. This ought not to be. If the patient present on time in the hospital, there is there's a better prognosis for the recovery of that particular patient. Do the right thing now and thank me later. Bless you.